Hi, everyone. Good afternoon. Are we up? Are we sleeping? Is it the potatoes? They were good, right? I say that in the last room I was in. I talked about the potatoes. They were delicious. I actually have a cup of potatoes waiting for me to take home because they were so delicious. Are we tired yet? Are we maxed out? No? Full throttle all the way? Okay. So my name is Joanne Oport. I'm the president and co-founder of Africans for Mental Health, and I'm also an appointed commissioner for the state of Maryland. I serve on the Commission on African Affairs. I'm going to be presenting the speakers today, doing some housekeeping. For this particular room, the conversations will be recorded, so if you don't want to say anything too personal, or you might want to say something personal that might be beneficial, this is the best place. We will be posting the information on the NAMI website, so this is a very good space to educate and empower our communities. In addition, I know you've been attending other sessions, and we really would like you to submit evaluations so that we can bring in the speakers again, improve on a couple of things, maybe have it as a 3-day conference, depending on the sponsors. Okay. Amy Greensfelder is the executive director of the Pro-Bono Counseling Project. Prior to joining PBCP, Ms. Greensfelder served as the Refugee Mental Health Program Coordinator at the Maryland Department of Health. In that role, she coordinated the implementation of universal mental health screening for adult refugees entering Maryland, support groups for newly arrived refugees, and peer support for refugees communities. Additionally, she has worked overseas in refugee processing and has provided immigration legal services as a Board of Immigration Appeals accredited representative. Ms. Greensfelder holds a master's in social work from the University of Maryland, Baltimore. Of course, she's going to be presenting with someone else. I love her name in brackets. Vanessa Sepopo Howard, correct? Is a clinical associate with the Pro-Bono Counseling Project. In addition to helping connect Marylanders with clinicians who agree to see them for free or for a low fee, Vanessa teaches cross-cultural psychology at Towson University. She's interested in the intersection of mental health and diversity-related issues. Through scholarship and professional experiences, Vanessa is dedicated to serving individuals with mental health concerns and educating others about mental health. So if you're on social media, hashtag NAMI MD educate, right? We want to be trending. So I want to make sure when I go back to our team meeting, this session was trending on social media, correct? I can hold you to it. Welcome.
Thank you. Thank you for that introduction. So the first thing on our agenda was to introduce ourselves, so I guess we can check that off as already having been done. The clicker?
Yeah, it's right up here.
Oh, here we are. Okay. So we're getting our ducks in a row, the next thing on the agenda. So I just wanted to start with a little bit of an overview of what the Pro Bono Counseling Project is, where Vanessa and I both work. We're a nonprofit that's 28 years old. We provide free counseling services, and the way we work is people who are interested in seeking counseling services but have limited resources and inability to pay out of pocket or have limited insurance are able to contact our office, talk with one of our staff members, and then we connect them to a licensed mental health provider who volunteers their time. At this point, we have over 800 providers all over the state of Maryland, and so people can call us from anywhere in Maryland to get connected to a therapist. I know some of the folks in the audience today are licensed mental health providers yourselves, so if you're interested in volunteering with us, we have our volunteer sign-up form, and you can grab one of those or talk to me and Vanessa after about signing up to volunteer. We offer free continuing education for those that volunteer with us. Today, we're going to be talking about cross-cultural therapeutic interactions. And as we got started, we did want to show just a little video to introduce you to the Pro-Bono Counseling Project. So this is the part that's always the scariest when you hit play on the video. There we go.
Good morning, Pro Bono Counseling. This is Anna. How can I help you?
The phones are always busy at the Pro-Bono Counseling Project, where inside a small office in Towson are matchmakers of sorts. They pair people unable to afford mental health services with licensed professionals.
We have social workers, we have psychologists, psychiatrists, psychiatric nurses, licensed marriage family counselors.
Amy Greensfelder is the executive director of the nonprofit that for the last 26 years has created a network of volunteer providers across the state who offer their services for free.
A lot of our cases are depression, anxiety, post-traumatic stress disorder, grief, life transitions, the whole gamut.
You have to have limited insurance, no insurance, limited finances. Immigration status doesn't matter. Everybody's welcome at Pro Bono.
Swaran Dhawan is a retired clinical social worker and one of more than 700 providers across the state who take on pro bono clients. She says treatment lasts as long as necessary.
Sometimes they may just need about 5 to 6 sessions. I've had couple that are going a little longer, depending on their need.
We call clients 1, 3, and 6 months after they've been matched just to check in and see how they're doing. And if there's any issue, they'll let us know.
The Pro Bono Counseling Project helps about 2,000 clients a year. Online testimonials are powerful.
I was in such a bad place, such a dark place, that I'm not sure what would have happened.
Well, if I hadn't found them, I don't know, maybe I committed suicide as I was planning.
When we call clients for follow-up calls, they'll say to us, I never knew how much in need I was until I've made it through the other side. My therapist has been so helpful. I have a light at the end of the tunnel. I can function so much better. I mean, that's really the good stuff.
Jennifer Franciotti, WBAL TV 11 News.
And so that's just a little more background about us as an organization and how we work. Last time I showed that video to a group, I happened to be wearing the same outfit as I was in the video, so I'm glad that I made the choice I did today of what to wear. These are the learning objectives that we're going to be covering today. We're going to be talking about the importance of cultural competency in mental health treatment. We're going to be talking about identifying one's own culture and how cultural identities influence mental health interactions. We're going to be talking about ways to encourage conversation about cultural differences. And we're going to be talking about community resources that are culturally responsive.
All right, so for this next portion, we may have to come forward or get closer to each other, but I do want you all to take a chance to communicate and kind of discuss what you conceptualize as culture. What is culture defined in your words? How do you define culture? What challenges are there? And then we'll reconvene as a group and kind of have a little discussion about it, okay?
So turn to somebody
to the back,
next to
the side, in front of you.
Maybe get up and move and find somebody if you're sitting far away.
You should have probably asked them to.
Yes. Yes. So right is this way.
Right. To keep that.
Let's take about 30 seconds to wrap up the conversations, then we'll come back together and talk about this as a group. Oh, I said just take another, at this point, like 10, 15 seconds, wrap up your conversations, and then we're going to come back together and talk as a group.
All right, so if we could reconvene, do I have any volunteers who would like to share what their conceptualization of culture is?
Any brave souls this afternoon?
Sure.
We're saying kind of social elements of your lineage.
Oh.
Okay. Okay.
Vanessa, you want to repeat back what you
Yeah,
said?
so this gentleman was expressing culture as more of a social lineage of one's heritage. Anything else that came up?
An attitude, beliefs.
Okay.
Behavior.
Attitudes, beliefs, behaviors. Food, okay, food, a central part of many cultures. All right. Language, okay, different elements of culture, language, food, identity, behaviors, values. All right, so, and these are all within the broad definition of culture, right? So there are many definitions of culture, and what we're gonna go through are a couple different definitions of terms that you may already know. You may have a different conceptualization of these terms. However, just so that we're on the same page as far as you knowing what we mean when we use certain words, we're gonna go through it. So again, this was discussed by many of you all. So culture really being information acquired by a group of people. This information is really shared through social learning, and it has the capability of affecting our behaviors, right? One person mentioned behavior, values, attitudes. Another thing to keep in mind about culture is that this sharing of information, we're sharing technology, we're sharing ideas, we're sharing beliefs, we're sharing values, we're sharing these different elements that will, in the end, create this cumulative idea of culture. Another thing to keep in mind is that culture is also a group of people within a shared context. So this group of people is within probably sharing the same geographical location, or probably not, it depends. However, there are many within group differences when it comes to culture, different norms that arise, different traditions that is communicated within a group of people, okay? Race, right? We all have a basic understanding of race. However, I will go through two basic definitions of race. So when thinking about race, the first thing that comes to my mind is the origins as far as this classification system, right? In the past, race was used as this classification system for different species, humans, and it can be broken down to biological and sociocultural elements. And when I say biological, I'm referring to more phenotypic characteristics, that more of that within group reproduction resulting in differences in hair texture or eye shape or skin tone. And then sometimes these groups with these shared commonalities develop these common identities, whether it's socioeconomic status or different political associations or experiences. These sociocultural identities thus bring these people together and can still be conceptualized under that umbrella of race.
And Vanessa mentioned that the original conceptualization of race had to do with classification systems, and I think it's really important to highlight that those original classification systems were developed to elevate certain racial groups and then hold other people down. So now we use these, it's historically and is currently used to create classification systems within people. And so that's where the concept originally came from. So anytime we're talking about race, I think it's really important that we keep that highlighted in the conversation.
I completely agree. And as Amy was mentioning, the more controversial origins of race are there, they're present, and it's important to acknowledge. Any questions? Not yet? All right, so when thinking about ethnicity, the most basic way to conceptualize ethnicity is a combination of race and culture. However, there's more to it. Ethnicity is really underneath that race and culture. It's more that sense of peoplehood. It's what brings a group of people together based on shared culture, experiences, language. And in addition, depending on the context that an individual is in, they may or may not identify with a certain ethnicity. For example, in a certain group of people, I may identify myself as a Black African American. However, in another setting, I may identify myself as a Togolese person. And so it really depends on what context. One thing to also keep in mind as far as ethnicity is concerned is that within a group of people, there may be many races that share the same ethnicity. And I was speaking with Amy earlier about this, and she had mentioned within a Brazilian household, there may be many races, okay? However, all of these individuals may identify as Brazilian. And so ethnicity is really that umbrella encompassing race, encompassing culture. And again, depending on what context the individual is in, they may or may not choose to identify a certain way. Did you have anything to add to that? Okay. Nationality. So nationality, the most basic understanding that I can provide you all as far as nationality is concerned is really the relationship between the individual and the state. Nationality is not citizenship. Citizenship is more so in regards to political rights, voting rights, or different obligations. However, nationality is more so, again, that relationship with the state. Where my nation of origin is will determine my nationality.
And I'd say too, this is thinking more in terms of a social definition versus a legal definition, because also you can think of, there are legal definitions that go into citizenship, and then also nationality can, in addition to the kind of context of Vanessa's talking about, of somebody's relationship to their country of origin or the country they're living in now, it might be very different from what a legal definition or might be in a passport or might be on a citizenship certificate. So this is more of a social definition and how people socially identify with the countries either that they were born in or are now living in or have lived in at various points in time.
Yes. So we have another activity for you all. So how many of you are familiar with the social identity wheel?
Well, so this is what it looks like.
Yes. So what we're going to do is pass this out, and within your same groups, if you could complete this wheel. I will mention that some of the identities on this wheel we haven't discussed. On the back, thank you so much. On the back is a list of the different identities, including, well, it's not an all-inclusive list, but a list of different examples for these different categories. So if you would take some time and fill this out, and there's some questions in the middle, and of course, in the end, we'll come back as a group and kind of share what we came up with and what stood out to you.
So yeah, take a few minutes first to do it by yourself without talking to your partners, unless you maybe want to think about some of the definitions. If you look at the back and you have some questions, Vanessa and I can help you, but just take some time alone first, and then after you've had a chance to complete it for yourself, then you'll share in your groups. I was just talking with this person in the audience, and she was just sharing that there might be other identity factors that are really important to people's social identity. So if there's other things you want to add on about your social identity that maybe aren't listed, feel free to add in other aspects of your identity that maybe aren't listed. This is meant as a jumping off point. So if there's other identity aspects that you want to add, feel free to add those in.
So let's take about 1 or 2 more minutes to complete the wheel, and then we'll reconvene and discuss what you all came up with. Don't forget to speak with the person next to you or behind you if you feel comfortable disclosing what's on your wheel. And then we'll reconvene. All right, everyone. So for the sake of time, hopefully you have all gotten a chance to share something on your wheel with the person next to you. But can someone let me know what identity really stood out to you the most as when you were completing this activity? Yeah, were there any identities that really stood out to you or that you identify with the most on this wheel? Yeah, go ahead.
So I actually identified with being the most because I felt like it wasn't really dependent on how I looked or my age or anything of that sort, or like where I came from. It was kind of just like, oh, I believe in this kind of religion. That was what was tying me.
Okay.
Vanessa, do you want to repeat it? So that
Yeah, so, and what was your name?
Amina.
Amina? Okay, Amina was sharing that the identity that's most salient is that of identifying with the Islam religion and being more salient in that that's what's most important, and everything else as far as age and gender aren't necessarily as prominent. Any other identities? Have a hand here? Yes. Age, okay.
Cultural, like right now, sometimes look down upon to be a millennial. I'm currently
Yeah.
But then it's also like, oh, you're really good at tech stuff, so we'll call you into our house if we need that. But otherwise, like, millennial.
Right.
Like age is really a big thing for me right now.
Okay. So perhaps age or being identified as a millennial really sticks out. I will say that teaching cross-cultural psychology on a university, age is something that's very salient for me, simply because a lot of my students look at me like I should be sitting with them. Nevertheless, I'm up front. Any other identities?
Yeah, would you like to share?
It's not so much for myself, but my son is adopted, and he is a different race than I am, and he comes from a background that he doesn't know where he fits. Because he's Mayan Indian, he's indigenous, his birth mother did not speak English or Spanish, and he does not have that personal history of his relatives that just isn't there. And growing up, he always lived in very integrated neighborhoods and went to integrated schools, but he wasn't black, he wasn't white, he couldn't speak Spanish, and because and he couldn't get hooked into the Native Americans because he was considered Native Central American, and he just didn't know where he fit.
Thank you for sharing that. So she was sharing about cross-cultural adoption, and specifically of a child who is Indigenous Central American and having trouble finding, the place that he fit in society, being kind of between cultures, and I think that's really important also. And that brings up to some of these definitions that we went through at the beginning of why some of them still stand for us today, and some of them work for us, and some of us identify with these things, and then some of us say, maybe these categories aren't really working for me anymore. Maybe I don't really fit into these categories in the way that the government forms and how society has categorized us. Maybe I'm, how do I interact with these categories? Anything else that came up for folks?
Some of my ones, I picked one, so the ones that I thought about the most was gender, race, age, and religion.
Okay, so gender, race, age, religion really stood out the most. What about those identities?
For me, with the gender is because, and gender and race kind of went together. When I looked at it, I just saw about my young grandsons being black males, and then so the gender and the race
being an aging woman, some of the things, the physical issues that with aging women, so I laughed when she was talking about the millennial, but so the women have the women that are older have the issue with aging and the things that they go through. And again, religion is because that's what I spend a lot of time. It's my church family.
Okay. So really thinking about the intersectionality of these different identities and how by having one identity, it may not be as separate from the next identity, and identifying as a Black woman or the gender and age, or again, the intersectionality of these identities really cause for different experiences. And I saw your hand up right over here earlier. Yes.
When we were talking, we realized that the things that we identify is different, but it's based on what we encounter in our experiences. So what we're going through now is this is what we see more.
So some identities being more salient depending on the current experience, and yeah.
And one of the things that came out to me was ethnicity, and it comes out to my family, and my family is very diverse and all across various ethnicities. And so going with what she said, I think it has to do with exposure. And then looking at physical, emotional, developmental abilities. If you have those kinds of experiences, issues in your family, religion as well. And then the other piece is with the first language and the experience that we have now as we interact in the world. Everybody doesn't speak English, and as you go and you interact with the different systems that you call on the phone for information, etc., you are exposed to other languages, and also when you get your explanation of benefits, insurance, and how all the languages come up. So we live in a different world now, and what you see is not necessarily what you get when you look at social identity. So that's the reason you need to clarify and not make assumptions.
Yeah.
And did you have something you wanted to share too?
Yeah, I think national origin is probably what I am when it comes to, I think, being American is, very unique and great thing in a lot of ways. And I think, I believe that, which is really significant thing for all of us living.
Okay.
And did you have?
Mine is actually very interesting. It just depends on the entry point. I'm from Kenya, so first and foremost, maybe some of the definitions in there don't include me at the point of entry. So mine would be first tribal, and I don't know where tribal would rank in there, but they would fall into ethnicity, and then moving to the United States, then learning that I'm Black or African American, because that's not how I grew up. Those are an identity I had until I moved to the United States. And then first language, from birth you speak at least more than one language, so I speak 2 languages from birth, so I don't really have a first language when they're doing like, when they ask me what was your first natural language, I'm like, well, English, Luo, Swahili, which one? I don't know. All of them were all taught to me, so it just depends on where you are again in life and how you enter into those spaces. Biological sex is, again, we're more inclined to speak of conversations going on in the media like LGBTQ and how you learn about those identities. But for me, I wouldn't even say national origin for me, because at the beginning phase when I was growing up in Kenya, it's my tribe. Your last name determines which tribe you belong to. So if I go into a Kenyan party and I say my last name, they'll be, oh, this is your tribe. So at the entry point, none of that even applies. And then in some instances, gender applies because men would be in one section, women would be in another section, and then the kids would be out
Yeah, you make a good point as far as depending on where an individual is from. Let's say they're from a more homogenous society, these different classification systems may or may not be something that exists until one enters here in America, where that's very prevalent, right? And there are a lot of individual differences. Some of the terms on here you may not agree with. I don't agree with all of them. However, in terms of how we classify the heuristics that we use to understand how someone identifies, these are some ways to do so. In addition, these different social identities do have a way of interacting with the therapeutic process. And I'll turn it over to Amy to.
Yeah, I'll talk more about that. And then one thing I do want to say too is this is a tool that we have extra copies of. You can actually find it online. It's from University of Michigan, is that right, where it originated? It says at the bottom where it is from. Oh, UMass Amherst. And there's different versions of it that you can find it online. It's something that we highly recommend doing. We were actually as Vanessa and I were developing this presentation for this audience, we thought, oh, we should take this back to our staff and do it with our staff back in our office. And it really gets people, and the reason that we suggest doing it is that when you're talking to clients and in a clinical setting about culture, it's important to first have a view of your culture, an understanding of your culture and where you're coming from and which of these characteristics you're identifying with, and having a good understanding of yourself then helps you to move into those cross-cultural interactions. And so now we're going to move into more of a clinical understanding of how cross-cultural works and influences therapeutic interactions. And so I'm actually going to start this part with a riddle. And so the riddle goes like this. A father and son have a car accident and are both badly hurt. They are taken to separate hospitals. When the boy is taken in for an operation, the surgeon says, I cannot do the surgery because this is my son. How is this possible? If you've heard the riddle before, don't give it away. But if you don't know the riddle, does anybody have any ideas? I can see somebody covering their mouth. If you have not heard the riddle before, anybody have any thoughts on this? I'll say it again. A father and son have a car accident and are both badly hurt. They are taken to separate hospitals. When the boy is taken in for an operation, the surgeon says, I cannot do the surgery because this is my son. How is this possible? A biological father, I'm hearing somebody say. The boy could have two fathers. Any other ideas? Okay. Anybody else? You knew that. You covered your mouth. I saw you. The surgeon's a mom. The surgeon's a woman.
Yes. I had the same reaction.
How is this possible? How could a surgeon be a woman in 2019? I heard this riddle on the radio about a year ago. And I probably am as feminist as they come. And I went to, it's a gay couple, two men married to each other. That's the solution to it. The surgeon's a woman. And I bring this up, the reason, what does that have to do with therapy? What does that have to do with in counseling? I bring it up because listening to that riddle, I don't know, nobody other than the person who'd heard the riddle before came up with that the surgeon could be a female. We all have assumptions that we make, and often we make these assumptions at this implicit level without ever even realizing that we're doing it. And I wanted to start with that because it gives you that experience of crap, I am an evolved person. I know doctors can be women, but I missed the part that the doctor could be a woman. And it gives you that experience that we all read into things based on what society has told us about how the world works, based on the things we read, based on the media we consume. I really think of things around bias as being like smog. They're all around us. We are all breathing them in, and we are all impacted, even if we think of ourselves as well-meaning people who think about diversity and culture. And we're all, I always think about sessions like what we're doing today. Usually people come to these kinds of sessions because you're already thinking and curious and engaging with it. Usually people aren't coming to sessions like this who aren't in some way interested in diversity and culture. So we're all here because this is on our mind and we're trying to do better, but none of us are coming up with the fact that the surgeon could be a woman. Uh-oh, I don't want this to go yet.
Where are you from?
California.
Okay, sorry. I just did not want that to play yet. I'm having trouble with this. And so I also wanted to share a story of something that actually happened in a therapeutic interaction. So that's a riddle, it's a puzzle, it's an old puzzle. But a part of starting with the riddle is to make the story I'm going to tell you more believable, because now you can put yourself in the shoes of being the therapist in this interaction. We had a client who was an African-American female who had recently given birth to a baby. And she contacted our office after giving birth and just feeling like she was experiencing some stress and anxiety, thinking about roles, thinking about changing roles after the birth of her child. We assigned her to one of our therapists. She went to the therapist. And in the course of the therapeutic interaction, the clinician said to her, "And now how does it feel being a single mom?" The client was not a single mom. The client was married. And I think if we talked to the therapist in that interaction, she would have said, surely somewhere in my case notes, surely somewhere in the presentation, surely somewhere in the information I had said this woman was a single mom. She wasn't. And the client really, rightfully so, was upset about this and ended up stopping therapy with that particular therapist. And there were other things going on in the interaction, but beyond just that. But I bring that up because I think many of us think, we'd never be that therapist. We'd never be the one to say something like that. We care about the people we're working with, and so we would never do that. We are picking up clues all the time based on what society tells us about people and the people that we're working with in clinical interactions. And so I wanted to share the riddle first to make that story believable and to realize that any one of us, we are all making shortcuts in our mind and making assumptions all the time about the people around us. And so we want to do the best to interrogate our beliefs about people and our beliefs about situations and go into situations with blank slates and with learning as we can about our clients so that we don't make assumptions about people based on what society has told us. This video that I'm about to show is a little over the top. It shows a clinical interaction and some things maybe don't go the way we would like to if we're all being ideal therapists, but I just want to show you, I wanted to show it because it shows some ways that therapists can make assumptions about clients. So as we watch it, I just want you to think about each time, we're only going to, this video goes on for 10 minutes. I would challenge any of you to watch it for 10 minutes. I watched about 1.5 minutes and I just had to turn it off, and that's all I will subject you to of it. But as it goes along, just see if you can pick out some times where the therapist does or says things that might be inappropriate. Oh, I see it. I just, can't see the mouse on where I was working from. There we go. And we'll see if it loads. And that was a lot of buildup for just a spinny wheel. Maybe we press play again. There.
Where are you from?
California.
But where were you born then?
New Jersey.
Oh. So what, are you black then?
Yes, I'm black and African American.
Your race is African American?
Right.
Okay. Yeah. Got it. Well, you're very articulate.
Thank you.
I think you certainly represent your race very well.
Yeah, well, I think, I had a lot of good role models in life.
Yeah, obviously you did. You must have gone to a pretty decent school, and you should be real proud of yourself. That's great.
Yeah, MIT.
MIT, is that right?
Mm-hmm.
Okay. Did you start out like cleaning there or something, and then worked your way into the classroom, or how did that work out?
I applied from high school and got in. I was actually the first person in my high school to go to MIT.
Wow! Congratulations.
Thank you.
Sort of like a prodigy for your race. That's great.
Well, there were other Black people there too.
Okay. I mean, and not to.
Okay, that's as much of it I'll subject it to. And it is obviously, it was a recorded thing set up to show clinical interactions and cultural issues that can come up in therapy. So anybody have anything to share, having been subjected to a minute and a half of that? Yes. It's so true.
My family and I went to grief counseling after my mother passed away, and 10 minutes into the conversation with the therapist, I turned to her and asked her, how many Black people have you done grief counseling with? And she said, I read many books about it.
Thank you for sharing that.
And then we just got to come back.
Yeah, thank you for sharing that. One of the comments on this video is, how is this woman sitting here through? Because this goes on for 10 more minutes like this, and it does not get better. Spoiler alert. And somebody says, how is she sitting there through this? And yeah, that's, yeah.
What she was saying didn't apply to our family.
Yeah. Anybody else want to share any reactions or anything that stood out about the video?
I guess I wonder how it would affect her going forward to seek therapy. I mean, right there she's sitting very calmly, and that could be just a training, a socialization that, you need to manage that expectation and be able to sit in the room and just listen to what you're hearing, because it's been a norm outside of even the therapy.
Yeah.
Right. So I'm wondering if after this session she would actually go to seek therapy to somebody else and actually seek help.
Yeah.
Or recommend for somebody else to get a therapist, right?
Yeah.
Because if this is her experience, then
one of the things that sometimes is seen in therapy is that somebody will be very eager to start therapy, and then they go once or twice, and then they're not going back to therapy. And often when I think that if it's become clear that it's a cross-cultural issue, you can tell that something like this has happened, and the person has said, nope, people vote with their feet and make their decisions and decide not to go back to counseling based on interactions like this. That's very true. Anything else that anybody wanted to share?
Therapist to student, because I can't even imagine.
Yeah.
Huh? Yeah, but I can't even imagine he would be a good therapist for anybody. I can't.
Yeah. So I hear you saying a bit of disbelief, but then other people saying it happens and it's been their experience with trained and licensed people who are not students. So again, these are actors in this, and I imagine that they might actually, I think it comes out of a counseling center, so they are people who are counselors or perhaps students in a counseling program who are acting these roles, but we see it with trained people who are fully licensed and are not students. You see these kinds of things. So
it's not only in the therapy subsequences for therapy.
No.
It's also in the clear space of mental health, like a strict mental health hospital.
Mm-hmm.
I have families in the African community who come to me and tell me that because I was being assertive based on what you are asking as a mental health hospital in the recovery of my loved one, I was being excluded from conversations.
Yes.
I was being talked to as though I don't know anything about what's going on. There was almost an assumption or disbelief that the person has this kind of resources or has access to this resource. And so it's not just only with a therapist,
Yes.
even psychiatrists are doing the same thing.
Yeah.
And even nurses who are working in this sector.
Yeah.
And so it creates a huge stigma
Mhm.
It's affected people in the African community, the African diaspora community, who have interacted with it. So I'm not trying to generalize, but those who've reached out have expressed that that's.
And one of the words I heard you just say is assertive, and you think of who gets labeled as confident and who gets labeled at navigating the system and being advocating for their family members. That's one way of saying something. And then you also call other people assertive or domineering or abrupt, and so certain people get certain labels attached to them, and from those same behaviors based on the color of your skin or your racial or cultural background, a different label might be attributed for the same set of advocacy skills. So that's important to think about too. So I am going to move forward from this so we can keep on time. And this then I'm going to introduce a tool that can be used as a counteract of this. This is a tool that therapists can use. Have any of you heard of a cultural formulation interview? Has that come up in anything you've done? Okay. So this is available through the American Psychological Association, the APA. And there's the link there, and I believe that you all will have the slides available to you after the fact, but the link's down there. But if you just Google Cultural Formulation Interview APA, this will come up. And it's designed to clarify aspects of a clinical problem from the point of view of the client and members of their social network. It's a different way of asking questions to formulate how that person thinks about the problem and how that person thinks of what the solution might be and how they view it in their culture and how they would share it with their friends and family. There's an emphasis on meaning, sources of help, expectations for services. So one set of it is the cultural definition of the problem. So the way that this is phrased in this interview is sometimes people have different ways of describing their problem to their family members or friends or members of their community. How would you describe your problem to them? Have any of you ever been either asked a question like that of a client or been asked that by a medical professional or a mental health professional? Has that ever come up? Is that something you would like to be asking your clients or would like to be asked as a client? Sometimes we hear things like clients would say to us when they contact our office, oh, I'm feeling depressed. I've heard about this post-traumatic stress disorder. I think that I have that. That's probably not what they're saying to their friends and family members. They're probably saying, I'm having nightmares. I'm still, just feeling so much loss and sadness over my husband's death. I can't get in a car again because of what happened in that accident. Those are the kinds of things they're saying. They're not saying to their friends, I think I have posted, some people might, some people talk like that, but most people are not. And so you're asking them how they see it, not in some clinical way or how they think you want to hear them talk about the problem.
And can I add, this isn't just limited to working with an individual of a different culture.
Yes.
These questions can be applied in the therapy process with any identities as a way of letting the individual express to you how they're feeling, what their experiences are. More of a respectful way of doing so.
Yeah, thank you for saying that. And one of the things I shared with Vanessa while we were preparing this is my mother-in-law was in the hospital a couple of years ago, and she's from the Southeast United States. This was in a hospital in South Carolina, and she is a white Southern Baptist woman. And the nurse was a white woman. I don't know of what kind of religious background, but there was a question on their interview form of, do you have any social or religious concerns about the care you're receiving, or that would social religious views that would influence your experience in healthcare or something like this? But the way the nurse phrased it was, I don't think this really applies to you. You don't really have any social or religious views that would impact this whole thing. Check, and then moved on. And because she saw my mother-in-law as somebody who looked like her, she just assumed that they came from the same social religious background. And maybe she did, maybe she didn't. Maybe my mother-in-law had something to share. I don't know, and I will never know. But she didn't have that opportunity to truly share because the person treated it as a checklist, as something to move on from. And so to Vanessa's point of even if you think that you're sharing either a social or cultural or religious similarity with your clients, it's really good to clarify and make sure and to ask this of all of our clients. You can ask, why do you think this is happening to you? What do you think are the causes of the problem? And you can even go on to say that sometimes people think that things happen because of bad things that have happened in their life, problem with others, physical illness, spiritual reasons, other reasons. So you're giving people ideas of things that sometimes people don't know what to say when they're asked questions. So there's additional prompts that can be used. And then to go back to that cultural wheel, we can then ask our clients about their background and identity. For you, what are the most important aspects of your background or identity? Give them the opportunity to self-identify. One of the things that we do at Pro Bono Counseling is we give people the opportunity to just self-identify. So we ask, how do you identify your race? How do you identify your ethnicity? How do you identify your gender? And it opens up a conversation about people's own identities rather than us making an assumption about the folks that we're working with. Are there any aspects of your background or identity that make a difference to this problem you're having? Could be a positive, could be a negative. We don't know, so we're going to ask. And then also asking about that clinician-patient relationship. Sometimes doctors and patients misunderstand each other because they come from different backgrounds or have different expectations. Have you been concerned about this? Is there anything that we can do to provide you with the care you need? It gives people, again, that opportunity to have that conversation and opens you up as somebody who's open to having these conversations. So in the situation that was given of the person in the, with the grief and not coming from the same place as a therapist, if the therapist had asked that, maybe the conversation would have gone differently. But just opening yourself up to that kind of feedback. And then I wanted to just go over, I know we're wrapping up on time, how to identify providers that are culturally responsive. These are just some tips for looking at providers. Looking at their resources, websites, what does their social media look like? What are they elevating on their website? So you can tell a lot about the viewpoint of an organization or a provider just on the language they use when presenting themselves, what kind of images they're using in their materials. It shows what kind of a lens they're approaching their work through. Do they have diverse staff, a diverse board, informational available about diversity, equity, and inclusion? Do people like you who look like you, are they on their staff? Are they volunteers with the organization? Ask questions. Ask the group, have you worked with members of XYZ community before? And listen to the answers. Sometimes the answer might be yes. Sometimes the answer might be no. But whatever the answer is going to give you an idea of their lens. I'll give you an example of this. I was at a meeting once and somebody was from an LGBTQ group was asking a senior housing provider if they had experience providing senior housing to LGBTQ individuals. And the person said, oh, we serve everybody. Everybody's welcome in our senior housing. And the person from the LGBT group said, well, you haven't really thought of the needs of LGBTQ elders if you're telling me you serve everybody, but you didn't actually answer my question. You didn't tell me anything about what supports are available, what you're doing, what kind of training you're doing with your staff around working with LGBTQ elders. And so even if the person, how people answer these kinds of questions can give you an idea of their approach. Do they have translated materials? Do they have access to interpretation? Again, this tells you what kind of a viewpoint they're coming at their work from. A really good resource to use, and let's see if this works, for finding providers is Psychology Today. This is for finding providers in private practice. Let's see if this was going to work for us.
We may have to minimize the PowerPoint to pull it up.
Oh, is it? Oh, it's coming up on my screen. Okay. Here we go. Okay. And what I wanted to show you with this is you can use this to find providers, and you can do it by insurance type, what kind of issues they address, what kind of, if you're looking for providers with experience working with gay, lesbian, or bisexual individuals, gender, age groups that they're used to working with, language, faith, types of therapy, online therapy, and I think in this issues, there's things here like, I wanted to show you, racial identity is one, and so you can see by what people have selected if they are what their experience is in working with different people. And you can read through their profiles and find out more about them. So when you're going to a provider, you're finding out what sorts of experiences they have, and you can use their profiles to help you decide if this provider is going to be a good fit for you and your specific needs. We are at time. So the last slide is just some organizations that we have worked in the past with, continue to work with, who we've found to be particularly culturally responsive in their views. So this is not a be-all, end-all list, but these are just some organizations that have worked specifically in different communities. And then there's another slide with some resources, but again, I believe that folks will be getting the slides so you can see all that on your
slides
phone.
will be available at the NAMI Maryland website. And also just requesting that the last 30 minutes while you're in the room, please fill out your evaluations and then turn in your badges so we can recycle them for tomorrow. If anybody has one more question, and then we can close.
When people sign up for work under your, or to be a volunteer, do you guys do training with them to ensure that they're culturally responsive, or do you just go screen them and sensibility at the things that you mentioned, or asking questions?
So yeah, that's a really good question. We do training on all kinds of topics for provider. That's one of the benefits that we provide to the folks who participate with us. We do provide training and workshops. Oh, sorry. It's on now. Okay, so we do training on a variety of topics with a really big spotlight on issues around culture, because our clients, I was sharing with Joanna, are just very culturally diverse, come from across the spectrum, come from around Maryland, all different kinds of backgrounds. And when we're referring the clients, we're having a conversation. So one of the things that we've found, one area that we find that providers often will say is, oh yeah, I have experience working with LGBTQ clients. And then when we call and talk to them, we find out what you're actually saying is you wouldn't turn away an LGBTQ client, but you haven't done you haven't participated in training. So we have those kinds of conversations as we're making the referrals. Certain ones we know have a lot of experience working with certain cultural groups, and so because of our relationship to them, we know. And then other ones, as people are new and signing up, we're having those kinds of conversations. What's your background? What kind of training? What kind of experience? And then we're able to help them get additional training as needed.
After having babies. When you get a report back, do you then reach out to the provider?
Yes, yeah, well, it depends. If we have the client's permission, then we would go back to the provider and talk about it. Sometimes the clients do say, yes, I want you to address this with them, and then they say, no, we don't want anybody to know anything, and then sometimes, you don't even get that feedback, so you don't, we do try to reach out to clients as cases are closing just to find out if there's been anything going on, and we reach out to clients at various points during therapy to find out information, but generally, we ask the client's permission, and if we do get that permission, we do provide the feedback to the provider. So that's one thing that our clinical team does, is kind of act as a liaison between the client and the clinician when there are breakdowns for any number of reasons that there could be a clinical breakdown.